So thank you, Victor, and thanks to everyone who's joined us in person or virtually. I am really pleased to be here, and Victor's emphasis on how this action collaborative is cross-sector, multidisciplinary, and is focused on considering all viewpoints is absolutely critical. And I wanted to emphasize it again. This is not a problem that can be solved by a single sector. This is not a government problem. It's not a healthcare problem. It's not a community problem. It's really a whole of society problem. And the only way we are going to continue making inroads to reverse the trends of this crisis is to work together. If we collaborate to ensure that the solutions we are advancing are comprehensive, address all who are impacted, and do not exacerbate existing health disparities, we will be successful. I'm really focusing on introducing the collaborative and the structure today. I went much more into detail about the problems and the issues yesterday with the internal group. But I did want to emphasize a point a couple points that Victor said. I really view this collaborative as creating the backbone, the background, the framework for sustainable long-term solutions. I think we're all in crisis mode now, which is very appropriate, putting money in, doing everything that we can, grants here, programs there, but this crisis will not go away in the next 2, 3, or 5 years. This is an issue that we will face in America for a long period of time. It's not just opioids. We know there's rising cocaine and methamphetamine. There's a crisis of suicide and other behavioral health disorders that are all really intermixed. And although the banner is the opioid crisis here, what I think this collaborative is really doing is building the structures and the sustainable framework for behavioral health care for the next decades. And I think this is absolutely critical and essential as we move from an emergency response to a sustainable, resilient, proactive, preventative-oriented healthcare system. So that's really the way I look at this, and I see the value more and more and more every day. And although the National Academies, Victor puts up that chart about things that are directly involved, I can tell you that there's so many other issues that the academies are working with us on. On Friday, I was extraordinarily pleased to be the sponsor of a National Academies workshop directly addressing the social determinants of health and how we address the social determinants of health in a value-based environment, which is a unique opportunity that's provided to us by our secretary's emphasis on value-based transformation. And even last week, you saw novel programs being announced about as many as 25% of Medicare recipients being eligible for primary care that focus on prevention and health, not fee-for-service. This is a real unique opportunity where the crisis is converging with some great ideas right at the tipping point, I think, of the entire healthcare system. So I am really, really pleased to be here. Those are my off-the-script remarks, and I'll get back to what I'm supposed to be doing to introduce this collaborative. But again, I really want to express my sincerest thanks to the Academy for serving exactly as what I think the Academy should be doing. An independent but highly collaborative partner that is always evidence-based, and when there's not evidence, telling us where we need to go look to create some so we can create that framework for the future that will cross all administrators, all parties, all levels of government, because what we're doing is really a public health service. So as Victor mentioned, the collaborative is composed of now 100 organizations that have committed to working together to reverse the trends of the opioid epidemic. This action collaborative, it was intentionally constructed to include as many stakeholders as possible so that we can assure that promising solutions will not inadvertently leave anyone behind. The collaborative will exist until the end of 2020, and over those 2 years will work to improve coordination amongst the many ongoing programs and potential solutions to combat the opioid crisis, as well as accelerate the pace of change by identifying and advancing the most promising approaches. As Victor mentioned, the collaborative is composed of 5 organizational groups. The steering committee provides high-level oversight and guidance to the working groups to ensure that our work is coordinated and that the objectives we have identified are achievable. The Action Collaborative members then divided into 4 work groups. Each working group is focused on a critical aspect of the opioid crisis, and these groups will analyze materials that currently exist, perform environmental scans of their fields to see what organizations, approaches, and solutions currently exist or are being developed, and identify and execute activities that can begin to produce actionable materials and solutions. The 4 working groups are focused on 1, health professional education and training. And as I mentioned yesterday, I think 2 cornerstones of sustainability are getting the workforce right to make sure that we are appropriately trained across the board and could be flexible for all types of health behavioral interventions. And I would say also getting reimbursement right, which is something that we're working on. If we get the workforce right and we get sustainable reimbursement, we can shift the entire system. If we don't have those 2, they really are sine qua nons. We don't have anything sustainable moving forward. Secondly, opioid prescribing guidelines and evidence standards. 3rd, prevention, treatment, and recovery services. And 4, research, data, and metrics. You will hear from each of the leads of these working groups in the next few minutes. Setting goals for the Action Collaborative really enabled this large group to focus our thoughts and ideas on what we needed the Action Collaborative to accomplish, as well as providing signposts about where this group will be moving in the next 2 years. The goals that will guide our work are: 1, identify and raise the visibility of complex challenges, outstanding research gaps, and needs of the opioid crisis that require a collective multi-sectoral response. Although many of those who are invested in combating the opioid epidemic understand that this is a complex problem, we feel that it is the responsibility of the collaborative to emphasize whenever possible that a single organization or sector cannot solve this crisis alone. There's also very strong academic support out of Professor Pitt's group at Stanford that says there's no single solution, that this requires multiple sets of solutions, often with intersecting goals, but all of which could have inadvertent negative consequences if we aren't prospective. We also feel that it is a key responsibility of the collaborative to identify gaps in the evidence base and to highlight where dedicated focus and resources could make a difference in changing the trajectory of this crisis, and I would say the next crises to come. The number 2 goal is to elevate and accelerate evidence-based, multi-sectoral, and interprofessional solutions to improve outcomes for those affected by the opioid crisis and overall the substance use crisis. The collaborative would have no impact without identifying, accelerating, and advancing promising solutions. Our working groups will scan their fields for existing effective approaches, highlight those effective approaches, and develop their own as their work progresses and gaps are identified. The items above, however, will be critical aspects of every solution we put forward, ensuring that the solution is evidence-based, that it is multi-sectoral, and considers all stakeholders, and that it's actually interprofessional. And 3rd, to catalyze action on shared priorities and solutions to help overcome the crisis and improve outcomes for all. The specific power of the National Academies is to bring together groups that would otherwise not collaborate, and we have done that in an intentional manner in assembling the Action Collaborative. The composition of the organizations involved, coupled with input from the public that we will be collecting through vehicles like this public session, will allow us to move forward in a more aligned manner. We do want to hear from you, and one of the reasons I agreed to be co-chair is I am the senior advisor for opioids policy, so I am the lead at HHS, so it's appropriate for me to be here. But as I've said in a couple of sessions, people have made comments that, what is the government going to do and how is the government? So for all practical purposes, I am the government, okay? So I am here to listen and to learn and to collaborate and to make sure that if there is a good idea that needs to be implemented, that we do it as quickly as possible. I am here as a mechanism to get into HHS and to the rest of the government for you. I can be your single point of contact, whether it's with HHS, CMS, FDA, NIH, whether it's with Housing and Urban Development, whether it's with ONDCP and Mr. Carroll, the quote drug czar at the White House. We can reach all those aspects. So this is not an academic exercise. It's an academic exercise, but one that is that intends to have actionable output and actionable science. And I'm here to make sure that if there's an actionable step that needs to be implemented, you have my word, my commitment that we will do this as soon as physically possible and elevate that to the highest levels of the government. So today you will be hearing from the leads of our 4 working groups so that they can provide you a more in-depth look at what each of the working groups are focusing on and what they plan to do over the next few years. Some of the products that the working groups are discussing are academic papers, toolkits, which I think are very important, webinars or series of webinars, a website repository of curated resources and tools, interactive infographics, explanatory web pages, among many others. Although we have constructed this action collaborative in a multidisciplinary, intentional manner, we know that it was impossible to include all the voices that need to be heard and to come to actionable evidence-based solutions. We want to hear from all of you throughout the progress of this action collaborative, not just during webinars and public meetings. We will have dedicated time for questions and comments from the public later on this afternoon, but please feel free to send in your questions or comments via the webcast whenever they come to mind. You can use the Q&A section at the bottom of the webcast screen. Please also feel free to email questions or comments to opioidcollaborative@nas.edu. That email address can be found on our website, and we'd really appreciate hearing from all of you. Your input is critical in ensuring that we can truly provide interdisciplinary and multi-sectoral solutions that consider everyone's needs and fields of practice. Thank you again for being here. When you think about the impact, although we are starting to turn the corner, we still have 70,000 people dying a year of overdoses, 70,000. I think one of the advantages I have in being in this role is I'm a pediatric critical care physician. And unfortunately, I had to bury 5, 6, 7 children a week because that's the course of practice. And I translate all those feelings I have working with families as frequently as possible, going to the funerals of their children, because your responsibility as a physician doesn't end in the ICU. It's caring for the family. And I think about the impact this is having on a family scale, one by one. It's hard to think of 70,000. But when you think of it that way, I don't think there's any higher motivation that any of us can have than to try to save those children, bringing them back to their parents, having those parents saved so they could raise their children, having our brothers and sisters live a fulfilled life without the scourge of this terrible biological chronic disease of addiction. So you have my commitment. I appreciate everyone being here, and I'll turn the mic over back to Victor. Thank you.